dentist and currently a oral and maxillofacial surgery resident. But today I'm going to be talking about kind of general like oral hygiene and how to keep your teeth and mouth healthy at home. So basically, I'd like to start off with things that can cause decay or rotting of teeth and unhealthy gums is bacteria. Bacteria is it's a normal part of life. You're going to have bacteria in your body at all times, hundreds of different species. Some are helpful, some are harmful. They kind of live in a whole ecosystem. But some of the bacteria in the mouth, such as strep mutans or streptococcus mutans, is kind of the main ones that can cause tooth decay. If you don't do regular toothbrushing and flossing, for instance, the bacteria basically feed on the same foods that you do. If you have little crumbs of pieces of carbohydrates or whatever food kind of just hanging out in your mouth, the bacteria are going to eat that too, and they produce acids as part of their waste products. Those acids can break down teeth over time. That can cause tooth decay, also known as caries, or rotten teeth, big cavities in the teeth, and they can be painful. They can lead to abscesses, infections, swelling inside your mouth. And if, at that point in time, if it gets to, basically that degree of decay, the teeth may need to be removed, or you may need surgical treatment to help address or treat some like the bigger facial swellings. Now, to avoid getting to that point, I recommend, you may have heard, don't eat sweets, don't eat or don't drink soft drinks, that kind of thing. You can do those in moderation and think about your overall health as well. You don't want to have too many sweets because you want ideally foods with more nutrition, high quality proteins and things like that. But it's more about it's okay to eat sweets in moderation, but also take care of your teeth. So we recommend just using a toothbrush and a toothpaste with fluoride. Fluoride has been proven to reduce tooth decay. You want to do this, brush your teeth at least twice a day, ideally after meals. So basically you would use circular strokes, kind of all around. You don't want to rub or scrub too hard to avoid injuring your gums, but don't forget to go all the way in the back, all the way in your back teeth, and on the back sides of teeth as well, your circular motions. And it's recommended that you spend at least 2 minutes brushing your teeth, just a guideline as to how much time and care you should take into brushing your teeth. Also, we recommend using floss once a day. It's good to use before going to bed. You take a piece and you'd use the floss by basically getting it in between your teeth. And it's, you want to be able to curve it around the surface of the tooth, almost like you're using like a squeegee or like you're wiping the surface of the tooth. You don't want to go just straight up and down. You want to curve the floss around the surface of your tooth and get under the gums, maybe like 4 or 5 times. And of course, do that for all the teeth. There's an old joke that goes, do I really have to do this for all my teeth? And the dentist responds, only the ones you want to keep. So that's generally what we recommend: brushing, flossing. You can also brush the tongue to help avoid bad breath odors, keep well hydrated, and we can avoid things like tooth decay, which can be painful, unsightly, and also avoid larger, potentially life-threatening infections of the face. And one of the other infections that can affect the heart, for instance, infective endocarditis, folks that have heart defects or, areas in the heart which make them more prone to gathering bacteria, you can get, those parts of your heart can become infected if you do not take good care of your oral health. The reason is that, if there's a lot of bacteria load in your mouth and you have gum disease from the bacteria being there, bleeding gums, that bacteria can get into your bloodstream and affect your heart, and you can get serious complications like infective endocarditis, for instance, which is a serious health condition and can be life-threatening.